So now on Oreo, we're going to go and try and treat his hip, and then we'll go down to the stifle and and then we can treat the lower leg as well. Okay. So in treating an area here, actually, especially the hip, we're going to be using a similar quantity of energy that we use on the lower back. Okay. So sometimes it's worth having another person just hold the dog when you're treating it, but in this case, we'll try and work by ourselves. Treating dark dog, again, in this case, I'll use the chronic setting, unless he's just had hip surgery or there's an acute injury. And then we work down to the hip itself, pressing the triangle button, going down to the actual size of the dog appropriate, and then treating that accordingly. Again, this is almost identical amount of energy that you're using for the back, and so your hand speed will also be fast over the actual hip area. When you're ready, you're pressing the head accordingly, which is a large head. In this case, you must make sure the dial is open to 5, as you would for the lumbar area, so that you've got the maximum area possible that it's going over. And when you're ready, you're going to go and treat. Make sure you work out where the hip is, because whether he's lying down, standing, or sitting, the hip will slightly change in position. And once you're comfortable, then you're working over that area. Again, try and stay to an area just over the hand itself, and don't go to a bigger area. So you've got enough power to go and maintain a depth of penetration down deep into the hip itself. And you're working and you're massaging that head deep into the actual coat itself and trying to get as close to the skin and using a continuous. As you can see, my hand is close to the skin itself, so I can actually feel the temperature generated around the hair itself, and my hand speed may go quicker or slower accordingly, depending on how much that heats up the actual hair itself. If you are worried and you think there is an inner hip problem, then you can open up the hip, and if they're compliant, you can actually treat them from the inner side of the hip and work on the groin area and do that accordingly. And in doing that, you can see it's a much more hairless area, so your hand speed may be a little bit slower in order to go over that area. And just make sure you're directing the beam as perpendicular as possible into the actual tissue and not doing it from an angle, because it will penetrate deeper into that area. Now we're going to go and treat Oreo the Cocker Spaniel with a stifle injury, and this could be just an osteoarthritic change, but you may be using it straight away post-surgery, so you might be treating as part of a rehab pre and post cruciate surgery. If we press here, you go straight into the dark dog. I'll go down to the musculoskeletal. In this case, I'm going to do it as if it was around the time of an acute cruciate surgery. And then again, we go down. You can see the stifle setting. We press there and choose the appropriate size of dog according to that. Again, if you're not getting success after 2 to 3 sessions, you can increase the size of the dog, and that's a very easy process to be able to do. In this case, it's a short setting compared to the chronic. We're only talking about 1 minute 50, and you could repeat if you wanted to. When we set the laser ready to go, choose the head and make sure the head is open, unless it's a really small dog and you might need to zoom in a little bit. But most of the time you're treating it at 5, the open zoom head. Okay? And treating around there, this is a really nice position with the dog on its side, and you're able to go and work your way around the stifle and treat the whole area in order to go and do that. And make sure you get under and in and around it. Do not go more than a couple of centimeters above and below the knee. And you might want to flex it and extend it as you're able to do, depending on whether the dog is able to do that. It might be harder in a more osteoarthritic dog, but just make sure you're going up and around it during that time frame. If I had time during the rehab, I would also treat the lumbar nerve roots at the same time, because if there is a cruciate damage, you want to maintain as much of the muscle as possible. If there is OA damage, they might be losing their muscle bulk, but also you want to improve their chronic pain, and in treating the nerve roots you can improve the analgesia to that lower limb. As you go around it, work and make sure that you're covering all of the knee during each of the phases, and if you are able to work on the inner side, that will help during this process and not just work on the outer side of the knee itself.